most famous physical therapist on the internet.
Hi folks, I'm Bob Shaw, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course,
I'm
Bob.
the man in black today, Brad.
Very, very outstanding.
You're the man in half black. So today we're going to talk about single best hip exercise to stop hip, back, and knee pain while walking. Big problem for a lot of people.
Right.
They start to get that. Can I say it?
You can say it, Bob.
They're getting the waddle.
Right.
They're kind of waddling back and forth.
As you age, and you'll see this, you'll see people get we call it a Trendelenburg. There's actual official name for it, and this. And when you start doing this, your back takes a lot of stress. The hips take a lot of unusual stress, as well as the knees, as everything's connected. We want to keep that safe. The big reason is, are we going to...
No, let's go. By the way, if you're new to our channel,
yeah.
please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to our website, bobandbrad.com, because we're always giving something away. What it is, we don't know. You're going to have to check it out.
Surprise.
Go to the giveaway section. Also, if you go to Facebook, our Facebook page, you'll find the contest will be pinned to the top of the page.
There
check it out.
You go.
Go to Twitter or Instagram or TikTok if you want a 60-second version of our program every day. So, yes, I've seen it where that Trendelenburg actually results in hip bursitis.
Sure.
Because it's rubbing against the bursa, and it ends up being pretty painful.
Well, and it can even lead to hip replacement.
Sure.
Or even knee replacement as it gets worse. So, if you start to feel that, and just in general, I think Bob and I are both old enough where it's like, our balance is not what it used to be.
Not what it used to be.
So this is going to help balance as well. That's the beauty of this exercise.
Right.
So it's just kind of a mainstay that is a great one for young and old.
Yeah, you definitely want to focus on these muscle groups if you want to improve your balance.
Yeah. So we're going to start out with the simple exercise, same muscle group. Then we're going to progress it to more aggressive exercise as you get stronger, or depending on what level you're at. So you can use a chair. You can go on a countertop, which probably a countertop is good because they're more solid. We don't have one here, so we're going to use chairs. And Bob will
show you. Want me?
That's good.
Face this way.
Yep.
Okay.
So you can see the profile of Bob, and you can see my backside, and you're going to stand with good posture, and we're going to work that glute medius muscle. That's the key muscle for this. Posture out and like this. Now watch my foot. If you point your toe like that, you are not doing it right. It has to be pointed straight in front of you and maintain it. And keep it in the air, I always have my patients. I don't let them come back and rest it. Out and back.
This, by the way, even if you're going to have like a hip replacement or a knee replacement, this is a great exercise to do prehab. In other words, getting it ready for the surgery. Because you want the muscle, want the hip as strong as it could be prior to going under the knife, right, Brad?
Yep, exactly. Now, if you notice that you're starting to waddle like that, but you're getting around pretty good, this exercise might be too easy for you. But I would start here. If you can do 10 to 15 on both sides with good form like we're demonstrating, and it's really easy, well, then it's time to add some resistance.
Well, make sure you're not dipping, by the way.
Good.
Yeah, don't be doing that. You're keeping the upper body straight while you're working the hip.
Makes a big difference on getting a good exercise, good quality.
So this is not a belt I'm wearing. This is actually one of those exercise loops, kind of a stretch band. So I'm just going to take that down a little bit, to right above the knees.
Yeah, and they're not very much.
No, these are just a few dollars. In fact, they give them away with a lot of exercise kits. And you can just work on, you kind of get to that exercise stance. Slight bend at the knees, slight bend at the hips. And you're just going to work going side to side like this. And this gives some nice resistance while you're doing that movement.
You can use a cane for a little balance.
Steady, you can use a cane.
And actually, we like if you have a walking stick, or we use the Booyah stick. It's
a lot better because you can get up in good balance and good posture.
You're right.
I feel a lot more steady with the Booyah stick. You can use any walking stick for doing this.
Right.
But this is a great exercise. Again, we talked about this in another video. You're strengthening the muscles like this going forward all day long.
Right.
But how often do you go side to side like this? You don't. And so these muscles can get very weak.
Now we're doing these exercises weight bearing, which is critical because you can do this exercise laying on your side. And it's a good thing to do, but it's not near as good as this. Bob, can you show them just a static
Sure.
resistance?
So I'm going to hold on to this.
There you go.
Like this.
So this is good. He's actually strengthening this hip and
Yeah,
hip
the other one's working too.
Right, and that's what a lot of people don't realize.
What's funny because this one I can actually feel fatiguing.
Sure.
As I'm doing this.
Right. That's the beauty of
I'm
this.
not dipping like this. You got me yet?
Yeah,
not dipping like this. I'm keeping it straight. So you were going to show the wall anchor?
Right. If you have bands like this, or you want to get some, these offer a little bit of a different twist on this exercise, which is, I would say, maybe a little easy, or gives you a little advantage, and you'll see why. This is a Velcro loop that goes around your ankle. They almost always come with your kits of these bands.
Exercise bands.
Yeah,
Yep.
I'm going to use the Booyah stick too. Now, what I'm going to do is I'm going to show you this exercise, and if you can do it without the stick and work your balance, that's great if you're at that level. I'm going to show you this way so you can have a better view of what I'm doing. So I'm here and I'm just doing this exercise. And if I go like this, it gets a lot more difficult. If you're at that level, that's great, but there won't be a lot of people doing this.
Always remember safety first, so we don't want anybody falling while you're doing the exercise. So make sure you know your limitations.
You may want to just use a chair and hold on to it and be at that, whatever you feel safe with. And then also with this, you can do the same thing Bob was doing. Walk out and back. And this offers... Oops.
Now you're going to have to hook it up to the other leg too to make sure you get both sides.
Right, exactly. It's a good point, Bob. What was I going to say?
Well,
I'm going to go this way with it. This actually offers a little bit different eccentric strengthening, which is an advantage, but not a big deal.
Yeah, it's just a different way to go about it. If you got the wall anchors already, because you can use it for exercising every part of your body.
Yeah.
It's nice to be able to throw this in there. You don't have to get the exercise loop. You already have it.
You don't have to have a wall anchor. If you've got a heavy table that doesn't move, you can put the band around a table or whatever to anchor it down. So here I got the other leg. So it's the same exercise, opposite leg. So, and you're going to do these until you feel it fatigue. It may be 10 to 15, 20 repetitions going back and forth like that, and work it all the options that we just went over.
Trying to keep it simple, find a way that works best for you and stick with that and get it stronger and stronger. And pretty soon you see that waddling go away.
Right. And your balance, everything gets better when your hips are strong and stable. Well, Bob, oh, Bob, why, Bob?
Always got to be a kid.
Yeah, exactly.
So thanks everybody for watching.
Be careful.